Good morning, everyone. My name is Olivia. So today I'm going to discuss the topic of the relationship between COVID-19 and mental health. I would like to first introduce some general information about COVID-19, then talking about how exactly COVID-19 impacts our mental health. The purpose of this presentation is to emphasize the importance of mental health issues, especially in this special period of time. Coronavirus disease was first discovered in Wuhan, China in December 2019. According to World Health Organization, globally, there are 140,886,773 confirmed cases of COVID-19, including 3,012,251 deaths as of April 27, 2021. The COVID-19 virus spreads mainly through droplets of saliva or discharge from the nose when the infected person coughs or sneezes. It is advised by doctors and professionals to protect yourself from this fatal infectious disease from staying home, social distancing, getting vaccinated, and wearing a mask. While many people may have already realized that the virus can impact us physically in a very negative way, we should also pay attention to our mental health, especially when people experience situations such as self-quarantine, economic crisis, travel ban, stress from social media, and online classes. The absence of routine and loss of social contact are particularly distressing to some people during self-isolation, which not only has an impact on mental health, but can also lead to the issue of lack of physical activities, as well as higher consumption of alcohol and drug abuse. Many countries in the world are implementing travel restrictions to manage the situation of the global pandemic. People are forced to get separated from their loved ones due to the travel ban. They have to wait for months or self-quarantine alone in a third country to be able to meet their partners again. International students studying in their own countries have to encounter the difficulties of the time difference and lack of sleep. Information and news report about the coronavirus disease were published on all different type of media platforms. Although this information can help people understand what the coronavirus is, we can also feel really overwhelmed and stressed if we constantly receive the related information. Many people are struggling financially due to the COVID-19. The unemployment rate reached the highest level since the Great Depression in April 2020. People in America experience economic hardship, and they have difficulties to pay their rent, to afford food materials, or even to financially support their children. Students have to take classes remotely. Many students claim that studying at home instead of attending the classes physically makes them really unmotivated and easy to get distracted. Many school activities are canceled. They cannot really enjoy their college life physically on campus. They miss the chance to get to know more friends and to build a professional relationship with their professors or classmates. Mental health includes our emotional, psychological, and social well-being. It can affect how you think, how you feel, and how you act. It can affect yourself individually and people who are around you. If you're feeling stressed, anxious, and depressed, you are not alone. you can look for some help from the local community or professional psychological counselor. Thank you for listening.